The topic is health and the cities. The topic is health and the cities, and we have our chairperson, Mr. Ankur Seth. He is Associate Director, PwC. May I request you to come up on the dais, please? Yes. Then we have Ms. Gao, Meiling Gao. Then we have Mr. Jagdish Harsh. Can I have you on the podium, please? Monalisa Sen. And Mr. Partha De.
All right. Hello, everyone. I hope I'm audible at the back. Thanks for being present today for this final session on health and cities. Good afternoon to each and every one of you and to the panel here. I think on health, as we think about smart cities and health, India is urbanizing at a rapid pace. And as urbanization picks up, the concept of two Indias coexisting in a city becomes that much more important, where both the haves and have-nots share the living space and go through their own different health journeys, if you will, in the same city. So I think as we think about smart cities and plan to urbanize our cities that make them sustainable, it is important to prioritize health and think about solutions that can meet the contrasting needs of both the groups living in the city. So with that, I'll open the discussion and ask a few questions to the panelists and solicit their views. And finally, we'll also have some questions from the audience at the end. The way I'd like to conduct is I'll ask a question and we'll give each of the panelists about 5 minutes to answer that question, and following which we'll move on to the next topic. So I'll hand it over for the opening remarks to each of the panelists for about 5 minutes.
Good afternoon, everyone. Hope everyone is enjoying the conference, and thanks for making it to the last session of the 3-day conference. My name is Meiling Gao, and I'm the Chief Operating Officer at Clarity Movement. We're an environmental startup based in Berkeley, California. And our mission is to make it easier to measure the air quality around us and make that data actionable and accessible by all. So throughout the conference, we've seen panelists and exhibitors talk about what makes a smart city smart. And I think, to me, it makes a lot of sense that the last session is on health and cities. Because at the end of the day, the goal is to really create and design cities that support a healthy population and improve health and quality of life for everyone. So poor air quality, as many of you probably already know, has very severe public health implications, whether that's premature death or cardiovascular disease or respiratory disease, and very severe economic consequences. But it's a problem that governments often deprioritize or they ignore because the consequences of air quality are often occur very far in the future. But it's a problem that is very difficult to solve because the sources of air pollution are numerous and it's very complex. It's also a problem that's not just affecting developing cities and countries. Cities like France, and like Paris and London, they've been in the news quite recently, the last few months, for their air quality issues. So it's not an easy problem to solve, especially when resources are very limited. So at Clarity, what we've been doing is focus on tackling the global air quality crisis through better data. It's hard to fix what you don't properly understand. And it's really important to get the data into the right hands at the right time. So that's the key. And that's what we're trying to do at Clarity. So we're leveraging low-cost and accurate sensors as part of dense networks in cities to change how we monitor the environment, to provide new insights that can create positive change. So these, the small size and the low cost of these technologies allow us to deploy hundreds and thousands of these sensors at the cost of one traditional monitoring station. So from these networks, we can actually generate large amounts of data and supplement the information that's coming in from these existing networks that the governments are operating. And it's basically exponentially increasing the amount of data that we can act on and use. So the ability to generate new data that previously wasn't possible is really important to improve our understanding of the air quality situations in different cities around the world. So with these types of high-resolution databases that we can generate, the cities can think about how they can communicate, provide earlier warnings to citizens for extreme pollution days to protect sensitive populations like the elderly. They can also use these data to really do pollution screening, find hotspots, and identify new pollution sources that previously were difficult to find. And the value of the data really extends beyond just environmental monitoring. It extends to other sectors as well. So for example, you can use it to evaluate different public policies like transportation restrictions, the greening of public areas, adding bike lanes, and also upgrading municipal fleets. So as the use of low-cost sensors proliferates, one of the common issues that part of the discussion is the accuracy of this technology. And there's been a lot of advancements and progress made on this front. So at Clarity, we've been doing testing of our own technologies in Mexico City with the government. And we were able to, as of last month, we were able to achieve 85% accuracy of our technologies against the government stations, the traditional monitoring stations, at less than 1% of the cost. And this is continuously improving with more data. So at this accuracy level, even though it's not 100%, the government is already thinking about the different use cases and how they could use this technology for, hotspot screening, evaluating impacts of transportation that, the city is trying to implement to address the issue of air quality in Mexico City. So no technology is perfect, and we don't need technologies to be perfect in order to be impactful. And for many cities, they don't have the luxury, because they're facing substantial, significant, air quality issues, to waiting for the science and technology to be perfect before they can act. So the promise, of low-cost connected sensors is pretty substantial, and it's really completely changing the way how we understand the environment around us and what we can do to make our cities healthier and more sustainable. And Clarity is providing the tools and technologies that generate the data that the government, citizens, communities really need in order to mitigate and to think about the policies to mitigate and protect against air pollution in cities. And we're really excited about the possibilities in the coming projects we're working on. Thank you.
Good evening, everyone. Can I have the presentation? I come from an organization called ICLEI. We are an international network of societies, of various municipal societies. And we approach the cities and health in a very different perspective. Most of the organizations working with cities look at cities only from the urban infrastructure point of view. We bring in the ecosystem services angle through which the health sector is addressed. Can I have the next slide? Can I have the next slide? This is just a brief overview of what ICLEI is. We, as I've just told, we are an international network of municipal associations across the globe with a membership network of over 850 plus, and we affect more than 15% of the population all over the world. Next slide. These are the various ICLEI offices. I represent the ICLEI South Asia office, which is headquartered in Delhi. Next slide. As I was talking, ICLEI works with cities. We have 10 basic agenda on which we work, out of which one is the biodiversity, wherein we bring in the ecosystem services angle into the perspective of sustainable cities. Next. You've skipped 2 slides. The next slide. Thank you. Ecosystem services are basically the foundation for sustainable cities. ecosystem service evaluation can help cities to make them better informed and take better decisions from all perspectives, including municipal services as well as health. And maintaining healthy ecosystems can provide cost-effective solutions to various adaptation strategies. Ecosystem services, as most of us would be knowing, are classified as provisioning, regulatory, cultural, and supporting. Health services through ecosystem services will fall under provisioning, regulating, as well as supporting services. As I was telling you, if we work on ecosystem services, it helps in planning as well as in regulation, which falls in the mandate of most of the local as well as national governments across the globe. ICLEI has developed some tools which help in the same. First is the manual for economic evaluation of ecosystem services for cities. This talks about how to map your ecosystem services and economically evaluate them and take decisions on the basis of the evaluation that comes up and approach your city development in a much more sustainable manner. The second is the development of something called as local level biodiversity action plans. This also focuses on the various kinds of ecosystems that are there at the local level in cities and how they can contribute to building a sustainable city. Within India, the National Biodiversity Strategy Action Plan is a mandate under the CBD, which India has signed. LBSAPs, or the local level biodiversity strategy action plans, are still to be developed across cities in India. Globally, many of the cities have picked these up. And another of our initiatives is called the Local Action for Biodiversity. This is a collaboration between ICLEI and IUCN, and this aims at integrating biodiversity conservation, considering all aspects, including ecosystem services, into local governance. Keeping these in mind, we have recently launched a new project on mapping ecosystem services and integrating them across various city regions. As I've just mentioned, the project aims at strengthening biodiversity management and to facilitate cooperation between national, subnational authorities on ecosystem management in the urban regions. There are a number of activities in that. Basically, the project focuses around the economic appraisal of the city's natural assets and the ecosystem services which it provides, develop pilot projects on the basis of which cities are made aware of the importance of various ecosystems which exist in a city, for example, a wetland or a city forest, not just from the point of view of servicing the city through water or oxygen, but even developing healthy spaces for citizens. And of course, a lot of international advocacy is involved in this project. One of the main things that it will lead to is the development of local level biodiversity action plans through which cities will be able to develop their strategies in a more scientific and evidence-based manner. And of course, it will have things like it will lead to integrated awareness, mainstreaming of biodiversity, ecosystem services, overall improvement in quality of life, health of life. And apart from that, it also falls under the ambit of the CBD, of which India is a signatory, and our biodiversity action plan and biodiversity reporting targets that we have. Thank you.
Good evening. My name is Partha. I work for IBM, lead the healthcare practice for India. Thought of sharing 3 different pointers in this discussion forum. One, definitely we have to make healthcare more important than what it is today in the overall smarter cities perspective. Honestly, it shows that this is the last sessions and we have hardly 20 people listening to that. So that proves where we are on this. So this requires definitely attention and priority. If we are not putting the attention and priority what healthcare requires, irrespective of whatever we do and whatever the smart we try to make a city, it will never be a smarter cities in holistic approach. Health is important, we all understand that. It requires the due attention and the priority. We all need to work towards that. Even if you look at all the smarter cities project and if you look at the RFPs what is coming up for those cities, you will find out health hardly get 5% of the attentions in any of these areas. where if you talk to any one of them, people do talk about it is the most important things, but it has to be, in practice. It is not that it has to be in discussions only. While we are talking about making a healthcare smarter, I would like to focus primarily in the area of how we can make a digital connected healthcare, where a patient or a citizen can get services irrespective of physically he is inside the hospital or outside the hospital. So that's the objective that we would like to establish as a part of the Smarter Cities project. We definitely talk about three different areas in this aspect. We talk about how we can work with the public health systems and make sure that the immunization programs runs more effectively, and we know who are the people got immunizations and who are not, and how we can get to them and get the immunizations on time. Similarly, we would like to definitely talk about institutional care when a patient is inside a hospital, and how we make sure that he has been hospitalized for the required time and not unnecessary hold in the hospital more time, and then start a home healthcare program where a people can be discharged earlier, so the beds can be available for the others who need it more, and those patients who can be treated at home as an extended hospital care, they should be provided care over there. Because this is an important aspect. It will take quite longer time for us to build all those hospital beds what the country need. But definitely we can manage this bed more effectively for the people who need it more. And a overall integrated approach of having a digitally connected ecosystem where you are outside the hospital or inside the hospital, if you are always connected and you are confident that you can get a healthcare assistance through the digitally connected ecosystem, I think patient will be not scared being at home when they really do not need a hospital-based care. Other point I would like to emphasize, sometimes not having a electronically connected health systems can be a boon for us, like what we have done in our mobility space. We have seen in mobility space we didn't have landline connection, that's why we have started with the mobile phones directly. And to some extent we have started directly with the smartphones. We are not going through that much of a churn of going through a feature phone versus mobile phone, where most of the other Western countries, the acceptability is at a lower level compared to the way we have seen the acceptability. So we should use this as an opportunity of not having a semi-automated healthcare systems, and the cities where we are going ahead with the Smarter Cities program, we should incorporate a completely e-enabled healthcare as a part of the program, and we start completely on electronic manner rather than going through a manual to semi-automated to a automated process. Ankur, over to you.
Thank you. Thanks to all of you for sharing your views and your experiences in terms of the areas where you work. I think this discussion can really benefit from your global experiences as well. For the first topic, I would like to discuss about the environmental health, and Partha, as you also mentioned in your remarks, where we talk about health as being a priority, but when it comes to really acting upon it, it doesn't seem that that is the case. More from a curative point, I think it definitely is a priority for families, for society. When you have a health issue, that's number one for you to solve. But from a preventive aspect, I don't think there is. In cities or as a society, we have that culture of adopting preventive methods for healthcare. And as cities urbanize, the issues around waste management, issues around pollution, these actually become very important from a preventive aspect. Once the person has gone to a hospital, and they definitely should get all kinds of quality care. But how do you reduce those incidents by designing cities that reduce the incidents and provide you mechanisms to adopt preventive healthy lifestyles? So I think that's what I would like to share, your views, solicit your views on that topic. And if you can, Partha, we can start this time with you.
So Ankur, very good point. We all keep talking about and we aspire to practice wellness in our regular life, where we found that we are not able to even practice the curative part of the healthcare the way we should have. So that's a challenge, but irrespective of not doing it, we have to start somewhere. And it's very important when we are going ahead with these smarter cities where we are starting a lot of things new. I'm not talking about the cities where there are already established systems, but at least with the cities where establishing a newer system, this is an opportunity for us to integrate wellness as a part of our regular healthcare delivery program. If we are trying to make wellness or a preventive health as a separate program and you would like to run it independent of a curative system, I think it will take a much longer time for us, both from creating that platform as well as creating that awareness for the people to accept it. What I think in integrating systems where we are practicing on the same platform, preventive as well as curative, that will give us a better benefit. Number two, definitely we need to find out what is the kind of a curative aspect we should look at, not looking at health as an individual subject, but looking at health collectively along with the other social and environmental factors. And that's very important. If we are thinking that we'll all manage this preventive healthcare independently, that is not going to happen. We need to definitely put it as a part of our social mandate. We need to keep talking about it and making sure that all of us got a preventive healthcare goal, and there is a way to measure these goals. We need to talk about it. Second is also we need to see how we can capture this as a part of our environmental goal as well. Because at the day end, these environmental goals are going to some way or other impact all of our health. So when we are talking about either it's a waste management policy or it's a managing of water, these all have very direct impact. So if we are not able to provide the water which is appropriate for drinking, so our basics is completely wrong. Then we take care of everything in healthcare, it will not work. So we have to definitely make the fundamentals right, making sure that we are having access to the right amount of drinkable waters to all these cities. And it does not mean that the city city always have a good drinking water. We are having this dilemma because we always feel that the people who are living in the cities, they are all having access to good drinking water, which probably not the right situation. In cities, there are a lot of places the people are having equally bad access to water compared to what is happening in the rural area. So we need to take care of those basics, looking at how we can put this preventive health along with the social and the environmental aspects. Ankur, I think that will give us a good starting point for us to look at preventive health.
Thanks.
Like I was saying, ICLEI works with cities. So one of our mandates is to capacity build city governments into understanding how to make resilient cities sustainable cities. Health as such is an integrated subject wherein when we address, say, waste, solid waste, liquid waste, water, any of these, everything is connected to health. So ICLEI has a lot of tools through which it helps city governments understand where they're lacking in any of these areas and how they can improve these services to finally address their health as well. So we help cities become resilient. Another component which should always be looked into and which is many a times not looked into is the informal settlements, who are a major integral part of each and every urban cluster or urban city or urban whatever living that we have. So health needs to be the informal settlements also need to be integrated when we are talking of resilience. And health in itself individually, I don't think is a topic which should be dealt with. It's a topic which is integrated with all municipal services, with all biodiversity angles. So it's an integrated approach which is required to address the issues.
So I want to echo some of the sentiments that Dr. Sen just mentioned. Like, I agree, a lot of the infrastructure and the processes in the city are all associated with health. And when you think about how to prevent getting to the point of disease and doing treatment, it really comes down to the design of cities. Whether that's creating, the proper urban green spaces for people to engage in social interactions that generate, positive mental health, or that's, bike lanes or walkable spaces to increase physical activity. So those are all related to health in the end, and that's also related to air pollution. Because if you design cities that are required to take drive to different access points, it decreases the air pollution that's emitted and can actually improve air quality. So it really, I think, it comes down in order to think about ways to prevent disease and especially reduce some of these environmental exposures. Thinking about how you design a city from the bottom up is very important.
Thank you. Thanks, Meiling. So I think Great conversation here on the topic, and Parth says, I agree with you that in some sense we don't have the burden of legacy, and when we design new systems, we can prioritize some of these aspects around health, and also I think in India, since the poor and the rich coexist in our urban cities, to the point that you were making, I think there is disproportionate burden on the poor when it comes to health in the cities. The haves, the consumption of the people who have resources actually creates problems that the not so well-to-do have to actually deal with. And I think when we design cities, it's very important to keep that in mind, that two sets of people live in our cities and the priorities of both of them are very different. And we need to have tailor-made solutions for addressing both. Also, I think around the air pollution or all kinds of pollution that our cities generate now, very important to design cities where we nip it in the bud. We adopt methods of sustainable living that do not generate so much of pollution. But I think now where we are, it is important to actually start measuring pollution. And we recently had episodes in Delhi itself here, where we had the city covered in smog for so many days during the winter season. So I think it's very important that there was a lot of conversation around air pollution during that time, but I think as that smog went away, the discourse has also sort of died. It's very important to talk about these things around the year and make them priorities for governments so that these projects can be taken up. Otherwise, I think if we talk about it when it happens, then I'm sure next year we'll again be talking about it and nothing would have really happened on ground. So really important as we design smart cities. We cannot have a smart city unless the city is healthy, right? So I'll move on, and I think one of the topics that we should cover is, as urbanization happens in India and across the world, more and more people move to cities to find livelihood. Traditional systems, traditional family systems actually break down, and we have more nuclear families versus joint families. There is much more mobility where young kids, once they're educated, have to go to different places to find work, which leaves behind the senior citizens in the city for themselves to take care on. And I think the cities also need to address that question of how we take care of the elderly and the other sections who would need a different design, different kind of services. I think to the point you were making, which is about providing care at home so that the encounters don't lead to a hospitalization all the time. And I think that's very important. So I probably, I'd like to solicit views in terms of what are the things, that can be done to actually reduce this kind of encounters or visits to the hospital and providing care at home. If technology can be used in that aspect, especially around digital.
So a couple of areas, Ankur, we can definitely look at, and interestingly, as you rightly pointed out, that we are having more need for home health care. So this will do two things. One is definitely it is going to make healthcare services more accessible at the time when they need it. Second is definitely it is going to reduce the cost. Now let's look at probably one or two use cases which is very prominent here, where we can look at use of technology while we are planning to have more care being provided at home settings. So two situations we can look at. One, we can look at out of hospital care where the cares were being provided in hospitals, and we are shifting the patients earlier to home setup, and where we are providing the similar of a hospital care in the home setting. So that will reduce the overall cost burden, and also it will make the patients recover better, because the chances of infections at home will be lesser than what it will be in the hospital. So that's one area. The second area is looking at the senior citizens and the people who are not having that amount of assistance available at home, and where they may need assistance. And there are times when they may need assistance where they themselves do not know that they need assistance. So these two things are very important. So technology definitely can play a very important role in the second situations where these certain parameters of these elderly citizens can be monitored, definitely without looking at the privacy, because we had these deliberations and debate a lot of times that how much of monitoring is actually required and where we should stop monitoring a person, because privacy of a senior citizen is also very important. So if you say that, okay, I will put a camera everywhere in the room and I would like to monitor what the person is doing, that's probably not intended. Particularly if you look at us when we become 20 years more older, I don't want to be monitored all the time, irrespective of, I live a good life or bad life, because that's a privacy that I would like to have in my life. But at the same time, I would don't mind if somebody, there is a mechanisms to monitor some of the vital parameters once or twice in a day, and somebody looks at those parameters and look at the trend and keeps telling me about what are the different things I may need to do to make sure that I do not need an hospitalization. So that's one. Second is, if there is an incident happened, like there is a fall in the bathroom or there is somebody. Now, if the person is staying alone at home, even there is a fall in the bathroom, it will not get detected till the time the maids haven't coming in the next day morning, or somebody will see that person is missing in the morning walk, so some neighbor would come and inquire. So by then we may have lost that very important golden hour to give the patient, give that person's back life. So there are certain monitoring mechanisms without absolutely intruding the privacy of that persons can be installed at home, and those can be monitored only looking at the health parameter, and some actions can be initiated looking at the various aberrations in the data that is being collected. So it's a combination of some data collection devices, if you look at technology of IoT, and then look at analytics, and somebody looking at sitting in a remote command center and looking at only the data when there is some completely different signals that you are getting from the normal behavior of the person. By doing this, definitely one can save people's life. Two is we can reach out to the person and help him when he need. Three is we can reduce the cost of the treatment, because we would be probably activating the treatment much in the earlier in the journey of the disease cycle of those people. So these two probably, in a home health perspective or out of hospital care perspective, and having more care being provided at home using technology enablement would be of great help. And when we are designing and defining things in smarter cities, this is just about a plug-in in the overall things. Because today we are talking about the cities are now being Wi-Fi cities. So it's not having Wi-Fi at home is not a big deal. But the question is, can we use that Wi-Fi for something else which is very important as health, and can use this Wi-Fi to monitor some of the important health parameters? That would not cost you a lot, and overall this is going to reduce the cost, because the person, if he has to go to the hospital, it is not only the hospitalization or the OPD treatment cost, it's also about the transportation cost, about him to get some assistance to go to the hospital. It's difficult to go out and get help, make an appointment, reach over there. Those things can be avoided.
Thanks, Partha. Dr. Sen, if you can share your experience from how globally cities are tackling with this challenge of designing cities for the elderly and solving their health issues, especially also touching around mental health, which is very important.
See, ICLEI as such doesn't really work into the health sector. What we work, again, I'm saying, is on sustainable cities. So one of our major focus when we work with the city governments is on vulnerability mapping, wherein where all the urban systems which are ultimately related to health, and even health comes up at times as a sector, we do vulnerability mappings of which of the wards in the cities are vulnerable, and in each ward who are the vulnerable actors. So senior citizens come up as a group of vulnerable actors in many of the systems that we consider, because everywhere it leads to health, and children and senior citizens are the most vulnerable from the health perspective. Then we help cities design strategies on the basis of the vulnerability assessments which come up with respect to individual vulnerable actor groups which come up, as well as the wards that come up. So that's how we help cities help design strategies which will look into health and other benefits for each and every vulnerable sector and actor that comes up.
Thank you. Meiling, if you would like to share.
Sure. So when there are extreme air pollution episodes in cities, it's pretty well documented that, the day after the episode or a few days after, the visits to, clinics, to outpatients, to ERs, it actually substantially increases. There's also greater numbers of deaths associated with air pollution. So really, this is pretty well documented, this link between extreme air pollution episodes and these visits to hospitals, which we really want to prevent because it increases the burden on the healthcare system. So part of it is, governments, city governments, they do provide a warning system. They, the day before, a few hours before, they say this, tomorrow's gonna be a red air day. Please stay at home. Don't run outside. But if we could find a way to provide better data and earlier warnings to our citizens, then we can think about ways that people can find other ways to basically modify the behaviors to reduce some of these exposures and reduce the number of visits that result as a result of these exposures to air pollution. So that's something I think is really important, and cities really do want to find ways to communicate these risks better to in more timely manner to their communities.
Thank you, thank you. I think that's also linked to what we talk about in terms of climate change. As the Earth warms up, and it is happening, that the trend is getting stronger and stronger by the year. Leads to more global warming, and the kind of lifestyles that we are choosing in our urban cities. It's leading to more and more air pollution. So definitely leading to many health issues, not only in the elderly, even in the young kids from a respiratory standpoint. What type of projects should are beyond of course installing sensors, collecting the data, and doing targeted interventions in areas where more pollution is found? What other projects, what other initiatives you think smart cities should prioritize, given that our lifestyles are not going to change overnight? That's a long drawn battle. While we may actually want to do that, adopt eco-friendly ways of transportation and eco-friendly design of cities itself, that's a long drawn battle. So in the absence of that, what can be done now, as cities in India, at least 100 of these, are planning to adopt smart solutions? What are a couple of projects you think from a pollution and climate change perspective that can be prioritized and that deliver the impact?
So, good, one point I would like to make it here. So, as we are looking at, let's take one example, and this is a work that we have done for Singapore, and that shows how the power of analytics actually can help in this sector. So, let's take dengue as an example. Now, dengue is more a environmental problem, let's say health problem, because the starting of the dengue happens differently and then it impacts you. So if we are going to treat dengue or going to prevent dengue, we have to see where these mosquitoes are breeding and how we are making sure that they are not breeding the way they are breeding today. So here is a project that we have done, because mosquito breeding has got something to do with the environmental factors, and the weather data actually can give you a lot of predictions when the chances of mosquito breeding in a particular area would be more, because there are a lot of data available which shows that within this kind of a humidity factor and the temperature, and if you definitely are having water locked over there, the chances of mosquito breeding is more. So suppose if you can monitor and predict looking at the data that you have collected over the years, and you can predict that when this particular conditions is favorable for mosquito breeding, and you can find out in a city which area where this breeding is happening more, then you can focus more on fumigations in this area. So what we are doing today, if you look at whenever dengue is happening, we are fumigating the whole city, and then the chances of success is less. So can we use the environmental data more effectively, and can we use them to find out where we have to do what kind of fumigation depending on what is the other environmental data? But today our challenge is our health and other environmental data, they are not synchronized. So health department works in one direction and the environmental department works in a complete other direction. If we can put both of them together, can look at this mapping of this environmental data with the health data and see that what happened over the last 3, 4, 5, 10 years, and using those data, how we can predict better that considering this situation, this area, the chances of dengue happening is more this year, we will be more successful in the prevention of the dengue, and and also management of dengue. So if we know that this area is having more dengue, then we can have more bed available. So today our main challenge is we don't know where we have to make the dengue beds available or where we have to make the doctor available round the clock, because we are trying to attack the solutions in an overall city perspective, and we are not being so effective the way would have been. So in the project that we have done in Singapore, we have used analytics, and we are in a way could able to predict better even a smaller place like Singapore, where the chances of certain communicable diseases are more. And this is a good aspect where we can utilize this to identify other communicable diseases. Dengue is one of the examples, because being in Delhi, we all are scared of dengue and chikungunya as well. So we can definitely pick up this example. We can collect and collaborate better, getting all the data from both environmental and health, look at the analytics, and accordingly put the resources to prevent and manage the diseases in that area. Will be much more effective in that way.
Thank you. I think Dr. Sen, also from the vulnerability mapping point of view, what you were mentioning, that collecting the data and then mapping the, because again, diseases like dengue or chikungunya, they are localized. They happen in a certain area for certain reasons, which is around environmental conditions that are there, and it affects different parts of the city differently. So if you can share experiences around how these kind of projects can be prioritized.
The vulnerability mapping that I was talking about is based on climate projections and past climate trends. So we do a climate analysis and understand what has been the earlier trend and what is projected to happen, on the basis of which how are the systems getting affected. And that's how, when you know what is going to happen to an already vulnerable system, then you predict that it is going to become worse because of maybe increased temperature or increased load, high intensity rainfall, and then you bring in solutions where that is what I was talking of, ward level mapping and developing vulnerability hotspots, basically from the area as well as the actors' point of view. One of the projects which we are presently doing is on low carbon resilient cities, wherein we are developing climate action plans for 4 cities, on the basis of which their vulnerable sectors are being addressed, and we are identifying pilot projects to be run, which will, of course, primarily aim at municipal services, but if we are addressing, say, solid waste management, in the long run, it's addressing health of the city as well. And as I was talking in the beginning, ecosystem services or the biodiversity has to be integrated into planning. The recent Chennai floods which we saw were one of the major reasons which brings our focus back to the need to have wetlands. South Calcutta wetlands are basically the kidneys of that city. So it's not just water which a water body gives. It's a lot of health, a lot of ecosystem services which are provided. So it's an integrated approach which is required for developing resilient, sustainable, long-term growing cities.
So before even proposing, I think, new policies that cities can implement, I think I would take a step back and think about trying to actually evaluate the current policies that cities are implementing. I think there's a difficulty in actually measuring the impact of transportation reductions, greening spaces. There's always this gap between what governments are implementing in terms of policies and what they're trying to do, and quantifying that it's been difficult. So cities have been doing a lot of policies around trying to reduce air pollution, but it hasn't always been effective. But they're still trying these policies. So I think rather than proposing something new, let's go back, and I think what we're proposing in Clarity is using sensor technology to really provide that information, and also give cities a quicker feedback system. Is if it's not working, let's try something new, rather than waiting multiple years to try something different, and the problem just worsens. So.
Thank you. Thanks for sharing your views. I think it's quite clear that data is our friend. More we use data, more we know about the conditions that prevail, and both retrospectively and using predictive analytics to look out in the future, right set of interventions can be designed for cities to actually do something about the health issues. both from a preventive standpoint and I think even from a curative standpoint. So technology, I think, is our friend, and I think there's also great focus in India right now on using technology to solve our day-to-day problems, and I think government is prioritizing that, the national government and states. And smart city is definitely a technology-led transformation of the city itself. And health, why should health be any different? Health should also use technology to solve the challenges in the sector. I think another topic is around looking at public health. In India, especially, we have had a culture where public health has been, government has played the role more of a provider than a payer. Where the trend has been to construct hospitals, provide for free facilities, both in terms of primary care, secondary care, and tertiary care. However, that trend is changing. But our public infrastructure in terms of health is definitely not adequate and needs strengthening. Whatever is there is also not, completely utilized or, works effectively. What kind of interventions should smart cities do to actually strengthen the healthcare system, and how can private and public players come together to create, to provide services? For example, for a citizen, it should not matter whether I go to a public or a private, and the experience should be seamless. How can that be achieved? And then the public infrastructure can also start coming up as an important area, as a backbone. Currently, the way it is that that's the last resort. Apart from few very good examples of marquee hospitals like AIIMS and others here in the city, largely that's the perception around public health facilities.
So one point is that we need uniquely, and that's the key. So if we want a patient to avail services equally from the private and the public healthcare, and what it should have been, so we have to make sure the patient has a unique identifications like Aadhaar, and that needs to be utilized in both the places. Number two is we need to also make the patient's medical data portable between the hospitals. Otherwise, we'll never able to achieve it. So once we uniquely identify a patient and we have the ability to share the patient's data between public and private healthcare systems, then patients really could able to avail the facilities both these places. Otherwise, if the patient's medical data is not available and is not portable, then irrespective of whatever we do, we would never able to have we have the inclinations, but we will not able to implement this a partnership between public and private health. But as a citizen, I would love to juggle between public or private depending on where we get a better services. It's not that everything I have to do in private or everything I have to do it in public. There will be certain situations where public healthcare services may not able to provide us. For those, I should able to go to private. But if there is a public healthcare services available, I should able to avail that depending on my consumer paying capacity. And then when I am going back to private or to public, then my medical data travels back with me. Other important point is also about making these services availability information public, and people should know what is available where. Now, if you look at in our country, we have a lot of schemes are happening on health. Now, in a lot of cases, whenever we have discussions among our colleagues and with the citizen at large, a lot of cases people are not aware of the various schemes that is going on today and what are the different eligibility that we have as a citizen to avail those services. So first thing is we need to make in a smarter way all these information available at the fingertips of the person. There should be a portal or a mobile app, doesn't matter whatever the interface it is, the person should have access to the information. If I have this problem, then what are the different options I do have in a smarter city environment, and then I should able to use my location to see which is the nearest one, and then I should able to also see using some criteria looking at what I should choose, and here I should able to use some criteria like NABH accreditations and others to decide which institution to choose for. maybe a starting or grading of the hospital. So I would not mind to go to a not so well institution for a regular fever and cold situations. But if I have a real challenge, then as a smarter city situations, even if I have to travel little further, I don't mind and I like to go over there. But very important is when I'm going over there, all of my medical record is available in the fingertips over there, and there are certain amount of privacy, certain amount of permission, etc. The law, those all needs to be figured it out. But it's very important we have access using biometric based unique identifications. We have a portability of medical informations available across all the players, irrespective of it is public or private. And also as a citizen, I have a choice to exercise depending on which healthcare facility I would like to utilize.
I would like to say that in India, at least, public health is not given the utmost priority. So we need policy level changes wherein public health comes up as a priority. Maybe smart cities have to have a criteria of how much and how they're addressing public health. The other thing that should come up is health services should be affordable. They are exorbitant, at least in India. A poor man cannot think of going into a private hospital. So even before going into public-private ventures or anything of that sort, a criteria for smart cities also should be as to how they are developing a framework or implementing it to make public health affordable. And another thing which it's again a policy level intervention that is required is in our SDG reportings. SDG 11 talks of safe, resilient cities, wherein we should have an indicator of how each city is providing public health access to all its citizens. These are measures which will probably force cities to start taking health as a much more important factor than it's taken as of now.
So I just want to let Dr. Sun know that even in the United States, public health is not really prioritized as well. Yeah, so it's something that's very common, in developed countries as well. So when I think of public health, I think of prevention. I think of not even getting to the point of needing a healthcare system to provide treatment. So I think honestly, like what we should be doing is providing more education, more awareness, whether that's around air pollution, water sanitation. I think increasing those types of services would dramatically also alleviate some of the burdens on the healthcare system, whether that's in India or even in the United States. So I think that unfortunately that is, dramatically underfunded in most countries around the world.
Thank you. I think absolutely right. I'll just discuss my experience on some of these points. I think from a policy standpoint, the recently released National Health Policy actually does talk about making primary care free and affordable and accessible to, not affordable, just free and accessible to everybody. And for secondary and tertiary, government has now realized that government cannot actually be the provider. So there is talk of strategic purchase of services, where the gap will be paid off by the government for at least the sections who cannot afford on their own. And I think now that the policy is there, it's a forward-looking policy. Cities have to do their own prioritization to actually achieve the objectives, and there's very measurable targets in terms of some of the diseases that we deal with in the cities. So policy level, I think at least at a national level, certain of these considerations are there and they're reflected in the policy. Hopefully cities will, I think, now prioritize, given that there is an overall directional shift, so to speak. And I think as primary care becomes free and government wants to play that role to provide primary care, and then secondary and tertiary is both between public and private. I think, Partha, to your point, the ability to move around with your medical records is very important. As I go in between public and private and get referred from a government-provided primary care center to probably a private secondary or tertiary hospital, the ability to move around with digital records extremely important. And I think we also think about not just having, records and identifier. Aadhaar, of course, gives us a great way of, putting together, collating those records and storing them under one unifier, one identifier. Of course, one has to think about security and privacy of that data, and how much of Aadhaar can we use in those instances. We think about it as a more of a digital health architecture that needs to be created, where you have identifiers, you have records, and then you have accompanying services, building to what is a digital health ecosystem, or the connected healthcare that you talked about in the beginning. And I think that's the way technology can help improve service delivery, and also provide more data about the aspects of healthcare system that don't work that well, and probably help us design better interventions. Let's say from a public health standpoint, if I have data in terms of how it is happening, what are the deficiencies, where all it's not present, I think there's more possibility to intervene for the decision makers in a smart city context, and probably connect it all the way to a command center and have better tracking on it. I think that's very important when we talk about health and think about health as a complete, digital solution that connects all different aspects of healthcare, which is, ensuring that there is availability of consultation, affordable consultation, medicines, diagnostics. I think a lot of care, a lot of health expenditure right now in India is out of pocket. And that's a big problem, because that's the leading cause for a lot of families going into poverty, simply because of a health issue, and that's very unfortunate. So digital can help us lower costs, and I think other countries have also done a lot of work in this area, adopting digital as a way of transforming healthcare, while the gap, in terms of providing for right number of hospitals and doctors, all that will still continue. That's a journey that will anyway remain. From global experiences, do we know if there are, 2 or 3 key things from a digital standpoint that a city should prioritize, whether it's the identifiers or whether it is the records? Those records themselves have some bit of, journey, because you have to talk about standardization, you have to talk about securely, storing them, sharing them, and all of that. So if there are global experiences that we can discuss, I think that will be great.
Yeah, so let's take up Scandinavian countries as example, because they have most of the healthy and happiness index wise they're on the highest. I don't want to talk about US, because definitely cost versus benefit creates a problem over there. So if you look at all those cases, definitely identified is the key. If we are not able to identify a person in a digitized system, we're not able to provide any service. So that's important. Second is also about ability to connect the various dots. In a digital environment, if so it will work as a chain, and there's any weak link in the chain will make the whole chain to break. So it's very important that we have all the various practitioners connected, all the various other ecosystem players. As you rightly said, that if for providing a service to a patient, that we need a doctor, we need a diagnostic service provider, we need a pharmacy, all of them need to be connected in a digitally connected ecosystem, and these persons need to be identified completely using one identifier and avail services there. Number two, the important point, while it will take time for us to make this whole medical record completely portable because of what is the standardization, etc. For us, it's much easier because we don't have any. So if a new smarter city that we are developing, we should be able to do it much faster than all the other cities where they are struggling, because they have already something and they are struggling to convert that into another format. But it would be much easier for us to define a format and just follow it. The other important point also, let's talk about adoptions. Now, it's very easy to talk about having this digitally connected ecosystem sitting in a conference discussion, but how we make these adoptions among the practitioners better. And adoptions has to be both by the citizen as well as by the healthcare practitioners. So here, ease of use is the key, and also making those important services available through digitally connected healthcare ecosystem. Now, if we say that, okay, only your OPD services are available. You can book an appointment and go without any, waiting time. That is good. But if I am not able to get a services in my emergency situation, then people would, tend to not use it for a longer term perspective. The other point is from a doctors and the other health practitioner perspective. If we make their life miserable by introducing some electronic gadgets to collect data, we have to, at the day, very important to understand that the doctors are not the typists. So we have to create a situations where their time to practice medicine with the patients gets more attention than what they do in a paper medical record. So if we are looking at that, we are talking about where they will be practicing completely using electronic format, and the time to enter the data will take more time than what the time they spend with the patients. It will never be successful. We all can keep trying doing it, it will never work. So we have to also make sure that the adoption aspect is very important, and the usability and the importance of the various availability of the services using this digital platform. These are the two key what I think will make it work better.
As I already mentioned, ICLEI is not really a health organization, so I really won't be someone who can talk of global examples from the health point of view. But yes, Scandinavia was one of the countries which I would have said, which is already mentioned. The only thing that I would want to say is, even if you're digitizing it, it has to be user-friendly, input-wise as well as output-wise. Complicated data entry as well as analysis systems are not going to work.
All right. Thanks for sharing your views on the topic. I think while we talk about digital definitely is a very powerful tool to transform healthcare, build the right systems with ease of use, both for entry, output, and making sure that technology doesn't come in the way of service delivery itself. A doctor should be able to, have a discussion and, talk to the patient and work with the patient versus typing too much data into the system. So I think that's really very, very important as we think of digitizing various aspects of healthcare and using that to transform the health journey of a patient end to end. I think while all these solutions that we talked about are important, one of the things that cities need to think about is developing a culture of demanding health, and that's where the citizen has to play that role. Unless we demand for better healthcare services, unless there is a culture of, prevention or wellness that we talked about in the beginning, the system will not follow up because you get what you want. Part of it is, really that simple. So how can technology or, other interventions be developed in smart cities that can help people come together and bring health to the center stage of the key ask? I think that's an area we should probably discuss.
It's a good point to deliver it. As I was trying to point out that only bringing digitizations will not be adequate if no one is going to use it. So the adoption is key. And then once we have certain facilities available through digitally connected ecosystem, then people participation should come. So it's a more a chicken egg kind of situations. In one area we would expect people to use it, in other area we would only create when the people have started using it. So from a smarter cities, and particularly the new smarter cities which is coming up, and if we can incorporate this in the design stage itself and use some design thinking principles and design something which has to be much more user friendly while the people are using it, I think that would help the people to adopt it faster. Once they adopt it faster, then these guys would start demanding it more. Today the challenge is that basic health informations are not available at all. One is that basic health facilities are not available. You have to first create and make the basic health facilities available. Second is that you have to make people aware of what are the facilities available and how easy for them to use these health facilities, and then only they will keep demanding more. So creating a platform where people should able to share their thoughts, and they should able to also participate in the designing of the overall, smarter healthcare ecosystem would also, make it more demanding. But it will take some time. Today our expectation is also less. Our challenge is whenever we go somewhere, particularly in this country, we always expect it will not work. And if it works, we become very happy. Now the question is, we all need to change our mindset and make sure that, okay, one is that if you're creating something, it will work. And definitely we need to look at that, how we can expect more or create more efficiencies around these areas. But at the same time, I think as a citizen, we also have a lot to follow. Like, you can think about creating a smarter traffic management system. And if we don't follow basic traffic light system, God help us. So at the day, and I think a citizen charter is also very important. As citizen, we also need to take responsibility of using things the way it is supposed to be used, rather than just thinking about that, what is the ways and means to break it. Like, this is another important responsible point that all of us need to take on us, rather than only looking at others to provide us better services.
So a top-down and bottom-up approach both is required in this, and extensive awareness generation activities, participatory activities are required. The whole smart city challenge was citizen engagement driven. So such is the approach which is required even in forcing cities or national and subnational governments to bring up the health sector on a priority list. That's what
So for me, health is closely associated with quality of life, and before people can start prioritizing health and thinking about it and pushing for it from their governments, they need to have the basic necessities met. There needs to be, access to food, clean water, shelter, security, secure employment, before they can really start thinking about, the quality of life and really pushing for clean environments and some of the things that you mentioned. And then you can see in, for example, in China with a growing middle class and some other societies as well, as they got to the point where they have, they're becoming more well off. This is something they're definitely pushing, from the governments as well. They're dealing with the air pollution problems there, food safety, sustainable cities. It's something that they will eventually start pushing for, but you can't really get to that point until some of the basic necessities are met.
Thank you. I think I have one more question to discuss, and then we'll open it up for a few audience questions before we close. I think it's also important to look at how, especially given in India, the technology industry has grown so much over the last few decades. We have the talent that is available here. And there's a whole startup ecosystem that has come up in the last few years. How can that contribute to solving some of the problems in health from a smart city perspective for the cities that we have? And what role can government play in enabling that? Given that government won't be able to do everything on their own, and young kids are solving all kinds of great problems, how can they achieve scale? What kind of right environment can be provided for that to happen?
And I think there is a lot of focus from the government as well. I am working with a lot of startups, health startups particularly, where they are coming up with an excellent use cases, which a lot of cases we never thought about, that people can actually find out those use cases and practically bringing solutions to solve those problems. The idea of scaling is here very important, and how we can help them to sustain, because as a startup they would have everything limited, and how we make sure that the limited resources what they have, that is being used most optimally, and then once we see success, how we are going to help scale them. So this needs to be discussed not only with the government, but the other organizations and the technology organizations like us need to play a very important role to help them sustain. And once they scale, then there is everything to get something from there. So if there is a startup organization and working on an IBM cloud, then definitely IBM cloud would get its due revenue at the day in some point of time. It may not be a great revenue to start with, it may be a small organization, but once this is scaling up, is definitely there is interest from IBM perspective. If some organizations is using Watson cognitive analytics to solve a particular use case. There is interest for us because if we know that if these guys are when they will scale, then but it may not be that every of them will scale. So if there are 20 startup organizations, probably one of them would scale. But it makes sense for organizations like us to get invested in the initial stage, have a complete look and play more a mentoring role. And today where I think, the startup organization, they need help more than money. They need the guidance and the mentoring. That is a very important thing. These guys have ways and means to find out some resources, but the mentoring they need from the industry as well as from the government, to my understanding, is more important than solving the financial problem what they have. So I think here both organizations, both private organizations and government should play that role more effectively than what we are doing today.
Sure, I can add to that, provide some global perspective. So as a startup, I guess in the Bay Area and being close to Silicon Valley, I think having the proper environment that's really supportive of us being able to bring new ideas to the table is great. This idea of low-cost sensors and create these dense sensor networks has been discussed quite a bit for the last few years. The US EPA has already done multiple working sessions on looking at the feasibility of using these sensors, but to date, no one's gone out there and actually deployed dense networks. And then that's really our goal, is we want to demonstrate that this is a lot of value in what we're trying to do and what's been discussed, but no one has implemented. And I think having a very supportive environment where we are able to prototype, innovate, and also be able to fail and repeat that process over and over again until we find something that works, I think is terrific. And also allowing us to be able to have the opportunity to bring new ideas and connect dots that previously weren't possible, bring partners to the table that previously have never talked to each other before, I think is great, and that's what we're really trying to do. And especially for a complex problem like air pollution in cities, we need to be able to do that and bring different partners, whether that's in government, industry, academia. I think it's really important because it's something that we can't solve alone.
Thank you. Thanks. Any audience questions? We have time for a few, please.
Thank you very much for the panel. So similar to air quality, public health is very much not just, it's too often siloed in government. It's a standalone where very often it's actually a consequence of transportation, energy, economic development in a much broader sense. We often hear that public health is a responsibility for the government to react to. However, it's very often, again, siloed to a department of public health. How could you see we could incentivize the participation of, for instance, the energy ministries, the urban planning ministries, the transportation ministries, to take a larger role in the externalities that ultimately result in the public health kind of externalities that result in the challenges that you're all dealing with? Do you have any ideas on how that could be framed?
So none of us are from government in this panel, but from our interactions previously, I think Niti Aayog is playing a very important role over here. Fortunately, I was with Mr. Kant yesterday and listening to him what he is telling. So if you see, that's the connecting dot agency that they are playing, and they are the policymakers for the government, and these guys are playing that similar role. And I'm very confident with the persons like him on board, you will see more actions happening on this area.
So I think first of all, putting a dollar amount maybe on health is really important. Unfortunately, that's it's very difficult to do. And the other process is maybe there's actually prioritizing it in the planning phase. So like we know in the U.S. and in other countries as well, we're required to do an environmental impact assessment before any major development project. And in Europe, that's starting a trend of doing a health impact assessment at the same time. So even before any projects are done, you already have to think about the health impacts. And so building that into the infrastructure and the process of development, I think is really important. It is a slow process. It's still very new, and even in the U.S., there's some resistance against it, but I think starting at the planning phase is very important.
I think absolutely right. I'll agree with the fellow panelists. If you look at it, I think it's the citizen that demanding better healthcare services, better access, affordable healthcare. That's really key to bringing the change. How do you go about doing it? I think at least in India now we can safely say government's actually working to make health bigger priority. And if you look at from a US standpoint, health is a very important topic in every election, whether it's for the right reasons or the wrong, but it's always an important topic in the elections. And unfortunately, we don't have that so much in India right now. But I think over a period of time, that will begin to change. A lot of state governments have prioritized health in India, and there are specific schemes, whether it is for coverage and other aspects. So definitely, it's changing. That change needs to be accelerated in terms of, and I think digital can play a role by connecting citizens, creating platforms and forums where the issues can be raised, those voices can be heard, and that will create, I think, sufficient pull for the government to act faster. Anyone else? Any other questions, please? All right, hearing none, I think we'll conclude today's session. Very engaging discussion today with the fellow panelists on wide variety of topics covering health in the context of smart cities. And I think it's very important as India urbanizes, as the smart cities, the projects get taken up. How do we think about designing the smart city with health embedded throughout the ecosystem, using technology, designing sustainable and resilient cities, and very important for that to happen right from the planning stage, as the panelists here have opined. At the planning stage, if we can prioritize health and design solutions that are easy to use, that are convenient for the citizen, accessible, and then from there on, the journey of digital health or health in a smart city can start. And while that happens, we grapple with issues related to environment, both in terms of cleanliness, pollution, because of the kind of lifestyles that we have today. And I think innovative solutions around using sensors to inform ourselves better, finding out where the pollution is and how can we act and nip it in the bud. I think those are very important. And I think all the smart cities in India, and this is a great opportunity, not just for India. Once we design solutions for here, some of these solutions are applicable to global context. So it's not only solving a problem for a country like India, it's creating a market for these solutions that is globally applicable. And I think that's really very important as we think about designing for health in the smart cities context. Any fellow panelists would like to share closing remarks, please?
Thank you very much. Definitely, it's very exciting to see that this particular topic has been introduced in the smarter cities context. It's not that very often we get an opportunity to talk about health in the smarter cities areas. So, thanks to the organizers for including the concept. I hope in the future sessions it will get a more priority, and we should be able to deliberate more on health along with the other topics in smarter cities.
All right, thanks everyone. Thanks for coming today, and thanks to the fellow panelists, Dr. Partha, Dr. Sen, and Dr. Gao for sharing your thoughts and your experiences on health. And I think as India thinks about smart cities, these experiences, this conversation, we should keep these kind of conversations going. So that some of the solutions, the experiences are available for wider audience to actually think about. Right? Thanks everyone.
I would like to thank our chairperson and moderator, Mr. Ankur Seth, for chairing a session so well, making it so interactive, and to the panelists to giving us in-depth knowledge about the health issues which are there. And with this, we close this session and the conference on the Smart Cities, one mega event. See you all next year. Thank you.